Let me ask you a very critical question. Even if the right drug is prescribed, even if it is dispensed correctly, what if it is administered wrongly? Wrong patient, wrong route, wrong timing. The result can be life-threatening. That's why NABH focuses strongly on MOM.7, Safe Medication Administration. Hello everyone, I am your NABH guide. This is one of the most critical and high-risk areas in hospitals because medication errors at administration stage directly harm patients. In this session, we will cover each objective element in detail, practical implementation, real audit expectations, common non-conformities, how to ensure 100% compliance. Let's begin. Authorized personnel. First rule, not everyone can administer medication. Requirement, only registered nurse, doctor, MBBS minimum, special case. Any other staff must be legally authorized. Assessors may ask, who administered this drug? Labeling before next preparation. Very common error in OT and ICU, multiple syringes prepared. No labeling leads to serious errors. Requirement, label each prepared drug before preparing the next. Applies to OT, ICU, chemotherapy. Patient identification. Golden rule, never give drug without confirming patient identity. Requirement, minimum 2 identifiers. Example, patient name, UHID, IP number. Bed number is not a valid identifier. Verification before administration. This is the final safety checkpoint. Must verify. Medication order, drug appearance, expiry date, if anything missing. Do not administer. Clarify first. High-risk drugs. Double verification required. Nurse or nurse doctor. Must be documented. Nurses must be empowered to stop wrong orders. Strength, route or timing verification. These are the core elements of safe administration. Must verify. Strength, route, IV, IM, oral etc. Timing system. Defined schedule for BD, TDS etc. Follow standard timing. Wrong timing, reduced effectiveness or harm. Prevention of tubing misconnection. This is a high-risk but often ignored area. Risk. Drug given through wrong line. IV vs epidural vs feeding tube. Safety measures. Trace line from source to patient. Separate different lines. Avoid extension misuse. Wrong route errors are often fatal. Documentation of administration. If it is not documented, it is not done. Must document. Drug name, strength, route, time, signature, ID, special cases. Infusions, start time, rate, end time. Continuous infusion, volume per shift. Documentation must reflect actual administration. Self-administration, some patients administer their own drugs, like insulin. Requirement, define if allowed, define which drugs allowed. System must include patient education, reminder system, documentation, outside medications. Patients often bring medicines from home. Requirement, define policy. Conditions, proper labeling, valid expiry, batch number, uncontrolled outside medicines, high risk. Common non-conformities, medication given by unauthorized staff, no patient identification, no double check for high-risk drugs, wrong timing, route, poor documentation, unlabeled syringes, tubing misconnection risks, no policy for self-administration, no control over outside medications. How to comply? Step 1. Staff authorization. Define who can administer. Step 2. Standard protocols. 5 rights of medication, verification checklist. Step 3. Patient identification system. Wristbands, 2 identifiers. Step 4. High-risk drug safety. Double check, training. Step 5. Documentation system. MAR, medication administration record. Step 6. Tubing safety. Label lines, staff training. Step 7. Policies, self-administration, outside medications. Final summary. MOM.7 is the last clinical step in medication management. Right patient, right drug, right dose, right route, right time means safe administration. If you are preparing for NABH, focus deeply on nursing practices, because this is where patient safety is finally delivered. Remember, a perfect system can still fail if administration is not safe. In the next video of this NABH training series, we will discuss monitoring after medication administration. If you want to learn NABH standard step by step, then video को like करें, channel को subscribe करें, notification bell on करें. so you never miss upcoming NABH training videos. Medi Quality Partners, your trusted NABH guide. Thank you for watching.